Hello everyone, thank you for watching the video. Now the next part of the thoracolumbar fascia and the posterior abdominal wall, the next subtopic that we are going to discuss is the visceral fascia and retroperitoneal compartments. What is this retroperitoneum? The retroperitoneum conceptualized in compartments, spaces, bound by fascia that limit the spread of fluid, blood, gas or disease. It is bounded by fascia that limit the spread of fluid. The fascia between the parietal peritoneum and the quadratus lumborum are confusing in literature. That's what literature do. They confuse the medical students. Fascia between the parietal peritoneum and the quadratus lumborum. What are those? There are main four ones. First one is Gerota's fascia. It refers to the perirenal fascia. Confusion over whether it refers to anterior, posterior or entire fascia. So what is it? Gerota's fascia. That's around the kidney. Then Toll's fascia. Fusion fascia behind the ascending or descending column. Sarker-Kandel's fascia. That's posterior or anterior perirenal fascia. Then Treit's fascia. Fusion fascia behind the pancreatic head. There are four: Gerota's, Toll's, Sarker-Kand and Treit's fascia. Those four you should remember, although it is confusing. So those are retroperitoneal fascias between the parietal peritoneum and the quadratus lumborum. What are the fusion fascia? A vascular layer allowing dissection formed by the fusion of embryonic mesentery and retroperitoneum. What is the clinical relevance of it? Bloodless planes for dissection, such as hemicolectomy, mobilization of duodenum and pancreas. Now, the key compartments in the visceral fascia and the retroperitoneal compartments. What are the key compartments? First one is the perirenal space. It is bounded by the perirenal fascia. It contains kidneys, suprarenal glands, and the perirenal fat. What are the anatomical continuities of the perirenal space? Laterally, it is continuous around the ureter. Medially, may interconnect anterior to the aorta and the IVC. So the perirenal space bounded by the perirenal fascia contains kidneys, suprarenal glands, and the perirenal fat. Anatomically continues with the ureter, around the ureter, and may interconnect anterior to the aorta and the inferior vena cava. Then the anterior pararenal space. It is located between anterior perirenal fascia and posterior parietal peritoneum. So the anterior pararenal space is located between anterior perirenal fascia and posterior parietal peritoneum. What are the contents in the anterior pararenal space? On the right side, we have duodenum, the second part of the duodenum, ascending colon, and the mesentery. On the right side, there's duodenum, ascending colon, and the mesentery. On the left side, we have duodenum, the fourth part of it, the descending colon, and the mesentery. Again, what are the structures inside the anterior pararenal space? Right, on the right side, we have second part of the duodenum, the ascending colon, and the mesentery. On the left side, we have fourth part of the duodenum, descending colon, and the mesentery. Now, the next part is the posterior pararenal space. The posterior pararenal space. It is between posterior perirenal fascia and thoracolumbar fascia. Thoracolumbar fascia. Posterior pararenal space is between posterior perirenal fascia and the thoracolumbar fascia. It contains fat continuous with the extraperitoneal fat and pelvic retroperitoneum. The posterior pararenal space contains fat and it continues with extraperitoneal fat and pelvic retroperitoneum. What about the peripancreatic space? Peripancreatic space. It contains duodenum, pancreas, superior mesenteric vessels, CBD, the common bile duct, the portal vein, and the hepatic artery. Contains duodenum, pancreas, superior mesenteric vessels, common bile duct, portal vein, and the hepatic artery. In the peripancreatic space, what are the boundaries of it? Posteriorly, retropancreatic fascia. Retropancreatic fascia is the fusion fascia of the traits. Fusion fascia of the traits. Fusion fascia helps you to what? To dissect. What's the fifth space that you have? The fifth space is the pericolic spaces. It surrounds the ascending and descending colon. It's continuous with the retroperitoneal fat of the iliac fossa. And the last one is the lateroconal fascia. It's the extension of retrocolic fusion fascia to the parietal peritoneum. The next part is the skin and the soft tissue. The skin supply. The skin is supplied by what? The muscular cutaneous branches of the lumbar arteries and the veins. The skin of the posterior abdominal wall is supplied by the muscular cutaneous branches of the lumbar arteries and their veins. The innervation is by the dorsal rami of lower thoracic and lumbar spinal nerves. Innervation is by the dorsal rami of lower thoracic and lumbar spinal nerves. Cutaneous distribution. Variable in L4 and L5. The cutaneous distribution is variable in L4 and L5. The fascial compartments. The intermuscular fascial layers delineate muscle compartments, the posterior abdominal wall. In the retroperitoneum, these compartments provide an anatomical framework for cross-sectional imaging and disease spread. So to summarize again, the fascial compartments, the intermuscular fascial layers portrays or delineate or shows the muscle compartments in the posterior abdominal wall. In the retroperitoneum, these compartments provide an anatomical framework for the cross-sectional imaging. Now, the last few parts, the bones of the posterior abdominal wall. Bones is supported by the vertebral column and the bony pelvis. What are the key structures? The lower two ribs, 12th thoracic vertebra, 5 lumbar vertebrals, L1, L2, L3, L4 and L5, sacrum and the ilium. Again, lower two ribs, 12th thoracic vertebra, L1 to L5 and the sacrum and the ilium. The clinical anatomy. The psoas abscess, which we talked about before, can track along the psoas fascia. It may point in the groin. Nerve blocks. Femoral and the lateral femoral cutaneous nerves are accessible under the iliac fascia. Used in image-guided nerve blocks for pain management. Fancy stuff. The cross-sectional imaging. Advances in imaging have led to better understanding. The compartments of it is hard to visualize, but it is useful in diagnosing. Thank you very much. We'll see you on the next video.